Good evening, everyone. My name is Jason Piercy, and this is a special COVID-19 update from us here at Out of the Fog. Earlier today, Premier Dwight Ball hosted a press conference alongside Chief Medical Officer of Health, Dr. Janice Fitzgerald, the Minister of Health and Community Services, the Honourable John Haggie, and also the Honourable Mike War, who is, of course, the Minister of Education and Early Childhood Development. They took questions from the media, made announcements about our school system and reallocation of resources in the healthcare system, and I am proud to say a little bit that it was slightly heavy-handed. That might be what we need tonight. So if you didn't get a chance to watch this when it was live earlier today, please enjoy so now.
Good afternoon, everyone, and thank you for joining us. As you know, that as a province and as a country and I guess as a world, we are in unprecedented times. These are indeed uncharted waters. And in these times, these unprecedented times, they call for some important decision-making. As you know, on Saturday, Dr. Fitzgerald announced the first case of presumptive COVID-19 in Newfoundland and Labrador. I want to thank Dr. Fitzgerald as her knowledge has informed decision-making, and she's conveyed important information. She's done it with clarity. Government will continue to support her efforts to safeguard public health while we address the emerging challenges. I've been working with our ministers, Dr. Fitzgerald, health officials, and the Cabinet Secretariat every day to ensure proper measures and proper protocols are in place. As a number one priority in all decisions is to protect the health and safety of Newfoundlanders and Labradorians. I've also met with our Joint Public Health Response Committee this morning, which includes opposition leaders Chess Crosby and Alison Coffin. As Dr. Tam, Canada's Chief Medical Officer, said, time is running out to flatten the curve. That's why today we are announcing that effective immediately, we are suspending all in-school class instruction throughout the province, early childhood education and daycare centres, and also the College of the North Atlantic. Tomorrow will be used as a planning day for teachers in our school system, and on Wednesday and Thursday, schools will be open for students to pick up their belongings and school materials. Further details will be forthcoming from the school boards. As of 7 p.m. Saturday evening, direction has been provided for all public service employees who have returned from out of the province travel to self-isolate for 14 days. We are asking everyone who can to work from home. As we currently are putting work from home arrangements in place for the public sector workers. A significant media campaign is also underway to ensure necessary information is being broadly distributed across the province. Since we become aware of COVID-19, we continue to review, continue to strengthen our pandemic plans and to ensure our provincial preparedness. We all have a role to play to ensure the safety of residents of Newfoundland and Labrador. We all have to practice what is a new normal. We want to ensure everyone takes the necessary precautions, which include social distancing and washing your hands. COVID-19 is an evolving situation, and our government will continue to monitor and, where necessary, implement protocols required to contain and delay the spread of the virus. I want to remind everyone that we have an 811 Healthline number available to assist with questions and concerns surrounding COVID-19. They will direct you to the appropriate person or place. We all know that there's been an extra large volume of calls through the 811. So extra resources have been added today due to the large call volumes. There is also a self-assessment tool to guide you through a series of questions in relation to COVID-19 symptoms, and this is at the 811helpline.ca. Our Provincial Emergency Operations Centre is in operation, and we have implemented our Provincial Emergency Plan and Business Continuity Plans. To ensure that we are addressing issues that come in, all government departments are represented in the Emergency Operations Centre. And for the most up-to-date information related to COVID-19, I encourage you to visit the government website, gov.nl.ca COVID-19. Again, the decisions that we're making is about prevention, not perfection. But we make those decisions with the health and safety at the forefront. This is about you, the residents of Newfoundland and Labrador. We will do whatever it takes when necessary to ensure your safety. I now invite Minister Hagee to make a few comments.
Thank you very much, Premier. Over the last 24 hours, the situation has evolved again, and yesterday we announced measures to bolster the acute healthcare system and to ensure the safety of our long-term care and personal care home residents. We're emphasising the system's ability to deal with surges and to deal with sustainability should this pandemic last as long as it appears to have done in other jurisdictions. Yesterday we put a restriction on visiting. There are no visits allowed to acute care facilities with the exception of children who are inpatients, obstetrics and palliative care. Long-term care visiting is restricted to one person per resident per day, and we would advise private personal care homes to follow the same logic. We have stopped all elective diagnostic and surgical procedures. Today is a transition day. There will have been some people who were travelling, so we have dealt with their issues. On a go-forward basis, it will be emergencies only. This will allow some washout time, as it were, to empty some beds, create some capacity, and to mitigate to some extent against the impact that may have on healthcare workers, where a significant number of these are women who be in the situation of having to provide potentially childcare now with the schools closing. In terms of sustainability, we have looked at our supplies. We're working closely with the National Emergency Strategic Stockpile and our federal counterparts to make sure we have the consumable supplies, the personal protective equipment we need, and also anything else that our experts in the regional health authorities tell us may be necessary. We're looking to the Centre for Health Information to ensure the connectivity of the healthcare system and, again, to enhance the ability of those people, where possible, to work from home. I can only emphasise that these are decisions we've made on the basis of information as recently as the last 18 hours. That information could change, and indeed has changed over the course of less than 12 hours in the past. For an accurate kind of up-to-date snapshot from a public health point of view, I'd like to turn it over to our Chief Medical Officer of Health, Dr. Fitzgerald, who is the public health and population health expert. Dr. Fitzgerald.
Thank you. Good afternoon, everyone, and thank you all for coming. So the COVID-19 situation continues to evolve rapidly. There is still one presumptive positive case of COVID-19 in the province, and there are now 193 people on self-isolation. Our public health system continues to be working well, and based on review this morning of the most recent Canadian epidemiological data, we've updated advice and recommendations. Our public health officials are well prepared and working diligently to respond to any cases that arise, and our regional health authorities are also prepared to respond. We believe we can make good progress towards flattening the curve and reducing the impact on our province by using measures such as postponing or cancelling gatherings and social distancing to alleviate spread. Social distancing is a term that applies to certain actions taken by public health officials to stop or slow down the spread of highly contagious disease or viruses, and such things as maintaining a distance of 2 meters between people, avoiding large crowds. So, you know, people, I think, should rethink their St. Patrick's Day celebrations in light of this. Please know that you are not alone. We realize there is probably a lot of anxiety out there. I encourage you to visit bridgethegap.ca to view the many options available to support your mental health and your well-being in general. As the Premier mentioned, an online self-assessment tool is available through 811 to determine your risk for COVID-19 and whether or not you require testing. There has been good uptake of this tool up to this point, and we really want to thank people for using this service. It has helped to alleviate some of the pressures on the 811 phone system. So we all have a part to play in reducing the spread of this virus. I appreciate everyone's patience and cooperation at this time. And while this may be disruptive and overwhelming, I think if we all work together, which I know we're all able to do, we will be able to help flatten the curve and protect the health of our population. Thank you.
Yeah.
Good afternoon. As the Premier has indicated, we have been monitoring the situation very closely with regards to potential school and childcare centre closures. There have been many discussions in the past 24 hours with public health officials, including the Chief Medical Officer of Health, and of course the school districts and the Newfoundland and Labrador Teachers Association. While we still have just one case of coronavirus in the province, out of an abundance of caution and in consultation with the Chief Medical Officer of Health, classes for K-12 students are being suspended effective end of day today, and regulated childcare centres across the province will close effective end of day today. At this time, the closures are for an indefinite period. Tomorrow will be a planning day used around logistics with the departments and the NLTA. And Wednesday and Thursday, students will be provided an opportunity to collect their personal belongings and books. The school districts will be in contact directly with the parents with further information on the logistics for students to do this. These actions are being taken with the safety and well-being of our students and staff top of mind. Contingency planning is underway and will intensify now as we work to maintain the integrity of the academic year. With this in mind, schools will remain open for teachers and staff for the remainder part of this week. This will allow teachers to prepare materials to be sent home to students in the short term. There is also long-term planning underway and options to consider, such as homework packages. All options will be explored by the school districts in consultation with the NLTA and the department. This will include teaching and staffing requirements. Further information will be provided in the coming days. We will continue to assess the situation in determining when schools and childcare centres may reopen, depending on emergency developments with the virus, which are rapidly evolving. We will continue to follow the advice and recommendations of our health officials on all matters related to this virus. Thank you.
What changed between yesterday and today? Because yesterday it sounded like there'd be other problems would emerge if schools were closed. So what changed to cause schools to be closed today?
Well, there's no question there's disruptions, in our society by the closure of schools. We recognize that. But what we've been seeing right now in some other provinces, and last night in Alberta, was, cases of community transmission within our communities. So before this, it was kind of connected to travelers, and what we've seen in our province is no different. Has been connected to a traveler. But in rethinking and reflecting on where we are, seeing what's happening in Alberta, seeing what's happening in Ontario, speaking to our colleagues across the country, late last night and early this morning, is we see ourselves in a position where we can be proactive and put necessary precautions in place and use the time that we do have to make sure that we do whatever we can to prevent, community transmission. Let's keep in mind, as Dr. Fitzgerald said, we still only have one case, but if you look at the trends that would have happened globally, we could expect more. And also, keeping in mind that we're having many Newfoundlanders and Labradorians that are living south of the border that are now making provision to return home. So there's a number of things, and this is evolving. And, So today we thought this was not a matter of if we would be closing schools or changing the way we deliver healthcare or education within our system. Knowing that, we made a decision this morning, working with Dr. Fitzgerald, that now is the appropriate time. We've met with our committee, as I just mentioned, as well. So we think for the health and benefit of all Newfoundlanders and Labradorians, especially those that are within our education system, now is the time.
Did public pressure play a role at all?
You always listen to people. There's no question. There was a fair amount of stress and anxiety in our society. But right now we have what we see is a community transmission in Alberta and some in Ontario. We know that there's a large number of people that will be returning home from Florida and from south of the border. And so all of this, keeping in mind that we want to do what's best, for people in our province and for our students. The other thing that I will say is that even though the school year right now is suspended, we don't know if we can actually get back to what will be a school year this year. So we'll be working very closely with NLTA to making sure that the academic, credibility of students are preparing for, their education, post-secondary education next year, especially our high school students. So there's a lot to be done, and we recognize, as I said, it's not a perfect situation, but we must make the necessary decisions that we think are appropriate at the time.
What does this mean for public exams now? We've seen schools close earlier this year. Now, not knowing for an indefinite period of time, are we looking like we're just going to cancel them?
Certainly, we're trying to give as many assurances that we can that the academic year will not be jeopardized. However, we will continue to work with the NLTA and both departments, to ensure that the right decisions are made for all students.
Is there a plan in place around fees and costs for these daycare centers, or refunds possibly?
Yeah, so right now, working with the federal government, we recognize that decisions that are responsible made by governments is that we accept the responsibility to make sure that those workers will continue to get paid, and the operating grants that are in place with our early childhood education centres, they will continue, recognizing that we are making this decision as a provincial government, and as a federal government there will be provision made to continue compensation for those employees and those owners.
There are going to be lots of parents who are going to have to take time off in order to look after kids, especially because childcare centres are closing down as well. Is there anything going to be done to financially help people who are now going to be missing out on wages because they can't work?
And this was a large part of the conversation that we had with the minister and with Dr. Fitzgerald, is when I talked about social disruptions that will take place of closing schools and universities closing up and CNA and so on, is it would mean that some of those workers that provide essential services to Newfoundlanders and Labradorians. But at the end of the day, the decision was made on the health and safety of Newfoundlanders and Labradorians. The details on how we compensate those employees and those workers, and these are things that we will be working out in the hours and days ahead here. We've been in constant contact with the federal government at this very issue, and they know that they have a role to play. There's some $11 billion that's already been set aside for provincial and federal funding. And, I've made the case in our situation in Newfoundland and Labrador is a little unique to some other provinces as well, that the financial capacity that we have in place, we're going to need a very different response for our province than what's required in some other jurisdictions as well.
But what about the issue
that ranges now? We see children who are now not going to be at school. We have grandparents. You mentioned this yesterday as one of the reasons that you thought shutting down schools maybe shouldn't happen immediately. Are we imposing that children maybe shouldn't be around those that are 65 and older?
Certainly we know that people who are older than 60 are at higher risk for the complications that may come from this virus and for more severe disease. So from a strictly public health and health point of view, it would be in the best interest if people who were in that age category were able to isolate themselves from other people as much as possible. So that's where we are with that.
Some people are asking for more guideline regarding self-isolation. Some people have come back from travel and their partner has not been asked to be self-isolated, so they still go to work. What do you say to those people?
So there are guidelines available, and our website does have guidelines available for how to self-isolate. Those guidelines are being updated on a regular basis. So I would refer people to the website for sure to get that
Just a
information.
bit further to that, there's been lots of concerns around these screening and screening issues. So these people who are traveling back from Florida, a lot of these people are driving. At what point do they need to begin to self-isolate? Because you come through quite an area, you might get off the boat in Port of Ask and make your way to St. John's with many stops along the way. At what point should they begin to self-isolate?
As soon as is practically possible. I mean, it is a journey. The issue, as Dr. Fitzgerald will tell you, is around prolonged contact with someone who is symptomatic. So I think the important determinant of what happens is whether or not you as an individual who've been out of the country have symptoms or not. Because if you have symptoms, you need to consult with 811 and receive guidance at an early stage about where to go. Quite frankly, you come off the boat now, Marine Atlantic have enhanced their screening. We're in discussions as a department with CBSA, and we're looking to see what else we can do to tighten up on that. I think the federal government, from my reading of the situation, are about to make an announcement about international air travel, for sure. But you're right, we still have a challenge with those snowbirds, as it were, who would probably drive home. I think the other thing it's worth mentioning at this point is, from a systems point of view, we still have an ongoing issue with flu. We get a second spike in this province, which is not usual across the country because of our unique climate, I suspect. But we need also to be aware that could present a challenge. We're still admitting 11 people a week with influenza-related illnesses. And so that was one of the reasons yesterday that we decided to try and act as early as we did to defer elective procedures until such time as we're out of the woods.
Most of these guidelines that you're talking about are voluntary. For example, the returning from overseas. Why not make these mandatory? We've heard anecdotal evidence from people in the community saying, oh, I don't need to abide by this. I'm healthy. This isn't applying to me.
If there is significant numbers or evidence of significant numbers of people who do not comply, we have that option under the emergency provisions of the new Public Health and Health Promotion Act. Those levers exist. We have briefing notes prepared in our department to see what might be necessary under ministerial authority to do that. Obviously, that is another restriction on people, but if we need to pull that lever, we'll pull it.
Mr. Haggie, you had mentioned today about putting emphasis on personal protective equipment for people in the healthcare system. NAEP today, issued a lot of concern about the availability of PPE for frontline workers. How big is the gap between how much PPE that we have versus what we need?
My understanding from the regional health authorities is that the equipment is there. The issue of sustainability is one of how you get your orders refilled. One of the unfortunate elements of this whole epidemic, this pandemic, is that the global center for manufacture of PPE is not just China, it's actually Wuhan and Hubei province. There are alternatives being explored. We have made every effort in the healthcare system to roll out the fitting and access to PPE on the basis of clinical need. So we started with first responders, emergency room personnel, and these kind of areas. So there may still yet be some people who have not had their fit testing to make sure their mask is appropriately sized, but that number should be a lot fewer now because that's an ongoing priority for the RHAs.
What about for those who are home care, who need home care workers to come in and support them? What precautions should they be taking? Are we looking at reducing, I suppose, how much help is needed?
Well, I mean, the help that people need is not going to change whether or not we have a pandemic on the go. The issue around home support workers and personal care workers, again, at the moment, the disease is coming in through travel. Our concern now, and one of the reasons, again, for reacting or acting preventatively, is the possibility that we may see community-acquired infections. So the key at the moment is to do the things we've outlined today with the Premier and Minister Waugh, but also to still focus our efforts on, as my colleague Dr. Fitzgerald says, shoe leather public health, containment, contact tracing, and testing. And that has increased day over day. And I think those are our assets at the moment. If home support agencies want to reach out and feel the need of further assistance, we have people available 24/7.
Dr. Fitzgerald, there's some concern about that there may be some cases that are spread by people who are asymptomatic, yet most of the testing focuses on people who are already experiencing symptoms. What do you say to people who are concerned that we may not be testing enough people to know the full extent of the virus right now in the province?
So certainly the evidence that we have right now indicates that the majority of spread is happening between people who are symptomatic, who are in close contact with people who have the disease. So that is why the testing is focusing on those people.
There have been concerns from public sector employees about still having to report to work. I know you mentioned it early on, but can you just recap what the plan is with public sector employees going forward?
Yeah, so right now, the plan would be to have as many public sector workers work from home as possible. Of course, those that are designated to be essential workers within the public sector workforce, they already know who they are. So from time to time, they may be required, to come into work. But this is really about making sure that, people that can work from home, we put into provisions that they're able to do so. So it's, once again, is about creating a safe space, for people and to help, the spread of COVID-19 through our community. And we'll take whatever measures we can as a government to work with our public sector employees to be able to do that. We already know that many private sector companies are also stepping up and putting in place similar action.
What about frontline workers, though? For example, Service NL, there are still lots of areas where you have government workers who are interacting with the public. What's being done to make sure that the person who's renewing their driver's license or someone at the court window down at Provincial Court isn't going to be exposed? We
will look for every opportunity that we have to provide those services by appointment or online, mechanisms that we could potentially have in place. As the example that you've just given us, we'll be working with our public sector workforce to have as many people work in their homes or some other location as possible, keeping in mind that some essential workers, like our public, people that work in healthcare, these are essential services that they must be ready to provide those services to people when they need them.
What about the workers who came home from abroad before Friday evening and were told were ordered to work because they came in before that announcement on Friday? Are they now told to self-isolate?
Well, right now what we're seeing is those that can show up to work. That hasn't changed since 7 o'clock on Friday. There are provisions made for some exemptions because that any time you put a number in place that 7 p.m. there were people that would not have had the opportunity to actually get the messages. So there's exemptions that have been put in place for, as you would expect from any straddling time, that when you put make those times available. So we're working with as many people as we can, mindful that, as I said, we just want to work with as many people as we can to make sure that people that can self-isolate, because what you're doing is not only you're not protecting only yourself, but you're protecting your family and others as well.
Can we get some clarification on the daycares? Does this include family daycares and day homes?
Yes.
They're ordered to close as well?
Well, day homes, I'll need clarification on that, but I think, Brian, you might have that answer.
With regards to, I think the regulated daycares, are asked being closed. Certainly with the day homes, I'd have to check that. I'm not sure.
Okay. What about, say, like private tutoring centers and private colleges?
Well, private colleges right now, we already know what the university will be doing on Wednesday at 5 o'clock in CNA, as I just mentioned, and we want to work with the private colleges as well. We expect that everyone will follow suit here because this is about making sure we put the preventative measures in place to protect workers, students, and also the most vulnerable that we have in our society.
Two quick questions. Does today's announcement affect MUN, and are there any impacts for similar closures of the courts?
Well, right now, I think what we've seen already as late as last week, the Supreme Court has made, they've not opened anymore. I think it was from May 31st. Yeah. Was a decision that was made, and we will need to be working with the Department of Justice and Public Safety to make sure we put proper preventative measures in place.
What about for provincial court?
Well, that's what I just said, is we'll work with the Department of Justice and Public Safety with the courts in our province to make sure. So, today's announcement is about our education system. and others, as well as the public sector workforce, but realizing there's still, this is an evolving situation, and there will still be, more announcements that we will need to make as we continue to work through, this difficult situation in our province.
And we've now how is the presumptive case doing? How is the woman doing?
As far as I know, she's doing well. Yeah,
It's still presumptive or confirmed now?
So as of this morning, an hour ago, it's still presumptive.
What about when it comes to people who have been out of the province? We're now seeing some community transmission in other areas, for example, places like Ottawa, where there seems to be a heightened concern. What's the guidance on people who may be coming back from other areas of the country?
So at the moment, we are asking people to monitor their symptoms closely and to, if they have any symptoms, obviously, if they've traveled, to self-isolate, and they can certainly contact 811.
Are
Minister
staff still
Haggie.
working at College of North Atlantic and MUN? Are staff still able to get into College of North Atlantic to clue things up?
Yeah, so, the provision will be now for no different than we would have seen. What we want to be able to do with the College of the North Atlantic is shift as many people, similar to what MUN is doing, to online courses. We've seen, MUN's announcement, Memorial's announcement on that, and so what we're working with CNAs to provide the mechanism to do something very similar.
Dr. Fitzgerald, tell us how, give us some numbers. You're talking students and at the college level and at the secondary level. How widespread is this? How many students are we talking about?
With regards to the K-12 system, we're looking at 40,000 students. 40,000, and we're looking at daycare, childcare. We could be looking at another 10 to 15,000 children. So.
Dr. Fitzgerald, what are your most recent numbers? How many people have been tested? How many negative?
So the numbers haven't been updated yet as of from yesterday's numbers. So.
Minister Haggie, we've had some employees of Central Health reach out saying they were on exotic vacations all over the globe, but were not required to self-isolate upon returning, despite their reservations, and apparently told by Central Health that they have to report to work. Can you speak to that at all?
This is the deadline effect. Prior to 7 p.m., I think, on Saturday, there was a different set of requirements in place than after. As the Premier referenced, you have a somewhat arbitrary time there, and some people are going to straddle it. The bottom line is, if you are well and you fall on one side, you can go to work. If you are well and fall on the other side, you self-isolate. The key is, if you become unwell on either side of that, is to talk to 811. Now, those are guidelines that changed between Friday and Sunday. I would not be surprised if we find ourselves in a situation in the next 36 hours of having some slightly different recommendations, and then we'll be caught up again in the evolution of how to apply that and how to inform people and how to communicate that in a way that makes sense.
Mr. Haggie, Dr. Fitzgerald, in terms of blood clinics, we're still going to be needing blood donations. There's still cancer patients within the province needing platelets. Should people still be going there? Is it safe to donate blood?
My understanding is that would be arranged through the Canadian Blood Services, which are a parallel independent arm from MCP, from the RHA mechanism. I would be guided by their view. They usually work on a system that can accommodate appointments, and I think the key is to avoid having a large number of people in one place at the same time. So with appropriate care and appointments, then it's an important service that should continue. But how that would look operationally, CBS will determine.
It seemed clear from other areas that ventilators are a key piece of equipment, and that's usually where the system gets strained. What's being done in order to add to our supply of ventilators in case we get to the point where we have large numbers of people who need help?
What we have done is, on the demand side, we have reduced the elective demand for ventilators with our actions over the weekend. There are a group of people with major surgery who would require ventilation as a matter of routine, so that takes that strain off the system. We have inventoried all our ventilators across the province, including spares, backups and transport ventilators, and we have been in contact with our central shared services supply to access, if need be, further supplies of hardware. The big key actually with ventilators is they're basically two components. There's a reusable kind of intelligent box, and then the rest of it is disposable. One of the challenges that we've identified is making sure we have all the disposable bits for the ones we've got. We're working on that. As yet, I have not been advised that there's any challenge there, but obviously that would in turn depend on utilisation. And we are in flu season as well. So
just tell us.
I'm sorry?
How many are there in the province? Is there sufficient medical ventilators in the rural area?
Each of the regional health authorities has a regional referral centre which has ventilator capability. Some patients do need to be transferred into the health science centre because of medical complexity, and neonates and young kids would be ventilated at the Janeway. The number of people on the basis of what Dr. Fitzgerald tells me who would require critical care is 2% of those people who show symptoms. We have 156 ventilators in the province at the moment and 98 intensive care beds.
Just tell us a bit more about this joint public health response committee that you formed. What is it going to be doing?
So yesterday, I had a conversation with both Mr. Crosby and Ms. Coffin about working, together on and sharing information. How decisions are made. Chess and I had a conversation earlier. Chess did reach out to me, and I reached out to Allison, and we agreed, that it was important now that as we reach decisions and consensus, and at least we share the information that we would have. And more than willing to do that, with other MHAs as well. But it's important that we continue to have that dialogue, and I think we all agree that this is not a time for politics, that we share this information, all of us, making sure that we keep first and foremost the health of Newfoundlanders and Labradorians. The objective here is to contain or delay the spread of COVID-19 through our province, and we think that we're in a unique position to work together to be able to do that with some of the measures we're taking today.
With 2 MHAs going into self-isolation, does that increase the odds the House will not open next week?
I've asked and we had this discussion this morning, so we've asked the House leaders now over the next day or two to get together and make a decision on what next week would look like. There's certainly business that will have to continue within Newfoundland and Labrador, whether that's required to have the House open to get that business done or not. We'll let the House leaders, get together and make that decision.
Dr. Fitzgerald, when it comes to the presumptive positive case that we have right now, was that patient captured, upon re-entry, or was that like a self-reporting situation? Do we know if this person was in the community before being identified as a case?
So the person actually was a traveler who presented with symptoms to public health, and public health swabbed them in that situation, and so that's how they were found.
Minister Ward, just looking for a bit of clarification on MUN. MUN will still stay open until end of classes on Wednesday evening, despite this announcement with the rest today?
Yes.
Okay.
Premier, there's been a fair amount of criticism of the fact that this is the first time you've spoken publicly over quite a few days on this. Compared to, for example, other provinces, when Nova Scotia had their first presumptive case, we saw a news conference like this. Why has it taken so long for you to speak publicly?
Well, I think I did 5 interviews on Friday from Ottawa. I think, as most people would know, there was First Minister's meetings that were with the National Indigenous leaders scheduled for Thursday and Friday of last week. So getting off the airplane in Ottawa was when I first heard that the First Minister's meetings would be cancelled. There were 3 premiers at the time that were left in Ottawa. Some had the opportunity to actually get back to the jurisdictions. And on Friday there was a 2-hour call that was scheduled with the Prime Minister. And of course, it was important that we stay on a secure line. And that is what we did. And immediately when the call was over, we came back to St. John's on late Friday, early Saturday morning. And on Saturday afternoon, I returned to my district on the West Coast, and certainly been in contact with Minister Hagee and with all our ministers, and certainly conference calls, lots of opportunity to actually work over the phone, and came back into St. John's last night. So I've been completely engaged with the decisions that have been made, certainly doing my part as Premier of this province throughout this whole process, which leads me here today.
Could I just contribute to that? I think if you go back to SARS and MERS and H1N1, the view was, as a result of those experiences where you had politicians out talking, it was felt that a single informed source of information that was credible and apolitical was really crucial. And you've seen across every jurisdiction for the last couple of weeks the medical officers of health. I spoke with Minister Delory in Nova Scotia, and I was aware that the Premier and he were going to be part of that announcement because they had 3 independent travel but not cruise-related cases pop up in the same 12-hour period. You know, I think it's a fine line between politicizing this, which is not a political issue, it's a public health issue, and the people that I've spoken to want to hear from an expert like Dr. Fitzgerald, not a politician.
Does Eastern Health have a shortage of test kits?
Not that we're aware of. There in actual fact has been some movement. We've been talking to Health Canada. There are alternate test kits that have not yet received Health Canada approval. My understanding is that that process is being accelerated, and that will then increase access to the test kits that will be available.
If more
No, it's okay.
If more presumptive cases come forward, will you be releasing the region of where those people are located?
Consistent with other jurisdictions, what's happened is we have released the region within which the person resides. I see no reason to change that. This is a very small province, however, and if you know it's a woman and they came back on a certain day from a certain destination and they're a certain age, it will not take a genius in Labrador to figure out who that person is. And I'm not going down that road. I really am not. So when we get our next case, we will supply a region, and that will be it.
But with Labrador Grenfell Health stretching into St. Anthony, do you think there should be some, explanation on whether it's on the island or in Labrador?
Central region covers Conagra to Fogo Island or Change Islands. Same logic, won't happen.
I assume teachers will continue to be paid. Will there be any provision for substitute teachers with this shutdown? Again,
decisions are made to suspend classes today. We'll continue to work with NLTA and certainly the department and the district to iron out those issues in the coming days.
Mr. Haggie, is there any advice for people who have conditions that make them sort of have weak immune deficiency syndromes, or Dr. Fitzgerald, either one of you, is there any advice for people with weak immune systems, how they should be handling this right now?
So anyone who is at increased risk for severe disease, we would recommend that they try to socially distance themselves as much as possible. So stay home as much as you can. Try to avoid large crowds. Try to avoid busy times of the supermarket or Costco, maybe Costco altogether. Just to ensure that you reduce your risk of contracting really any illness, because it is, as Minister Haggie said, it is flu season, so flu can be devastating as well. So it is important to try to keep yourself safe that way.
Any plans regarding bars, restaurants, stores?
Well, it's social distancing, and we're seeing business owners now, across the province that are taking it up on themselves to actually put in place, regulations. Keep in mind that the responsibility on all of us as individuals is to make sure that we protect ourselves and others, and so therefore you make what would be informed decisions with the information that Dr. Fitzgerald and others that will put out into our communities, and we expect people to do so in a responsible manner. And we've seen, as I said, private sector businesses right now, private owners, putting in place regulations to actually fit to where we see ourselves today.
Is it in your plan to put some
if we don't mind going there, we obviously, there's discussions, that would occur amongst ourselves. We certainly don't mind going there, but we recognize this is having a huge impact on our healthcare system, having a huge impact also on the economy in Newfoundland and Labrador that is already strained, but making sure that the health and protection of individuals in Newfoundland and Labrador is our priority. Those decisions will need to be made, but we will make those decisions.
Just one last question.
I'm not sure if this is already asked, but is the DMV also something that's going to close down?
The motor registration, you mean? Yes. No, as I said earlier, what we're looking for is to make sure that we, as many as possible, will work from home. We've talked about, making sure that we, if in an appointment situation, that people could go and get the services of motor registration on an appointment level, and also keep in mind that as much as those services that we can provide online, we'll continue to do so.
We are a small island, small population. Public shaming those who have recently traveled, how unhelpful is that at this point?
Well, right now, I think, what we need to do is make sure is respect each other's. This is a healthcare issue, and we respect each other's privacy, realizing that, anyone that has been tested positive with COVID-19, they could run the risk of impacting others and other families as well. And so while we ask is let's respect each other and making sure that this could be any one of us at any particular point in time. This is an evolving situation. Where we were on Friday is very different than where we were in this province on Saturday, and it's very different than where we are today. And I would anticipate over the next hours and days that this will continue to evolve. I don't think it would be surprising on any of us. We can learn a lesson from what's already happened around the world. And even though we are an island, we are an island and a province with a sparse population, and in Labrador it's no different. It's a large geographic footprint with a sparse population. But that does not prevent COVID-19 from having a significant health impact on our province.
Dr. Fitzgerald, there's also a huge impact on people's mental health. People out there are showing a lot of anxiety surrounding this. Can you give people some, I know it's impossible to say, but can you give people some reassurance? Is this going to go on all year? Is this like 2 months, 3 months? How long?
That is a difficult question to answer. Certainly what we've seen in areas such as China, with strict public health measures, with everybody doing their part to reduce the spread of this disease, staying home, practicing good hand hygiene, those sorts of things have worked to reduce the spread and therefore change the trajectory of an outbreak. But China started with this in late December, early January, and they're just now, starting to see reduction in cases as a result of all of those measures. So, we're not in this for the short term. This is a months most likely, but very difficult to say precisely.
Can you explain the difference between self-isolation and self-quarantine? Because I think we've thrown out the former now, haven't we?
So isolation applies to people who are unwell, and quarantine applies to people who are sick, technically. We have been using the term self-isolation since the beginning of this to imply anybody who was home basically staying away from anyone else. But technically, if you come back from travel and you are well, and we ask you to stay at home, you are actually being quarantined. And self-quarantine means we're not putting you in a quarantine facility, you're quarantining yourself at home. Isolation would mean that you feel unwell, and as a result of that, we've got special restrictions in place to help prevent you from spreading the disease to somebody else.
Thank you all for your questions.
For a second,
this is your last
what
one.
the challenges could be with having a flu outbreak at the same time as a pandemic to the health system?
Yeah, I mean, this virus and severe influenza basically affect the lower respiratory tract, the lungs. And so they have a common path in terms of the way they evolve clinically. So it's really additive. We have more flu cases in this province this year than there are COVID-19 cases in Canada currently. We've had 461. We have 60 people in hospital at this present moment with influenza-like illnesses. You're then going to add another disease on top with the same kind of pattern.
All right, thank you everyone for your questions. Really appreciate it. Of course, thank the Premier Minister and Dr. Fitzgerald for speaking here today.
Scoot you out. Don't run you over.
I can imagine some of us watching this and hearing that press conference, listening to answers to some of the questions, might think that maybe some of these things are a little bit drastic. I would argue that that is not at all the case. I would like to see a situation whereby we look back at this pandemic and say, sure, hardly anybody here got sick. We overreacted. Why'd we have to close all the schools? Everything was fine. It wasn't that big a deal. That's the entire purpose behind these decisions and behind social isolation. It keeps everyone safe. I'd much rather look back at regret and say, oh, I could have worked those 2 weeks, than look back and say, I really, really, really miss my grandparents. Thank you very much for watching this special presentation of Out of the Fog. Stick around with us. We're going to bring you all of the COVID-19 updates we possibly can. I hope you have a fantastic night, and we'll see you again soon.